preventing diabetes complications. And today's webinar is sponsored by AmeriGroup. And AmeriGroup also gave us Quentin today because he is a health coach with AmeriGroup. So he is joining us again today, and I'm going to tell you a little bit about him, and then we'll get started with preventing the diabetes complications presentation. Just a few notes for today's presentation. One, everyone is on mute, so if you have any questions, you'll need to use the chat box. And the chat feature, you can write a message, and that is going to be the red bubble on the bottom right-hand corner of your screen. And also, if you want to ask any questions for Quentin, that's going to be the blue question mark on, or it might be gray too on your screen in the lower right-hand corner. So if you have any questions, use that question mark feature and enter your question and click enter into the chat box, and we'll be able to get that answered at the end of the presentation today. And then we'll get started again, and I'll introduce Quentin, and then we'll get going. So Quentin is, again, a health coach with AmeriGroup, and he has an MBA in healthcare management. And he's worked as a health coach for the past 10 years. So he has a lot of really great experience that he's going to share with us today. He's also been a healthcare professional for about 20 years. And he consults members on things like asthma, diabetes, hypertension, weight loss, stress management, and tobacco cessation. And he works really hard to ensure that everyone is well prepared to live a healthy lifestyle. And that's due to the education that he provides. So again, we're really excited to have you here today, Quentin, and I will let you get started.
Thank you, Amanda. I appreciate you and the Diabetes Association of Atlanta for having AmeriGroup be a part of the ways to actually encourage and keep individuals healthy. Now, as stated, once again, I am Quentin, health coach with AmeriGroup. And I think it's important, of course, to understand that as individuals managing diabetes, that the doctor has already instructed you of ways to make sure that you keep your blood sugar under control, including diet, exercise, and of course, the medications that he or she prescribed. But it's also important to note that if you don't get a good handle on those three things that I mentioned, that there could be some serious complications that could follow. So it's important, of course, to make sure that you stay as focused as you can on those three things that are mentioned, as well as having proper consults and visits to your doctor on a regular basis. Now, as stated, diabetes is a chronic condition. Of course, there is no cure. And it affects how the body turns the food that we're eating into energy. Now, most of the foods that we are eating are broken down into sugars and then released into your bloodstream. Now, the average individual without diabetes, when that blood sugar is going up after you've eaten a nice meal, the pancreas releases insulin, and insulin acts as a key to let the blood sugar flow into your cells and be used as energy. Now, when you have diabetes, your body doesn't either make the insulin as well as it should or use the insulin as well as it should. And then, therefore, we have too much sugar in our bloodstreams. Now, that's where your doctor and your healthcare provider comes into play. And that's when they start to mention the ways that you should help keep that blood sugar under control. And that includes diet, exercise, as well as the medications that they are prescribing. Now, over time, if you don't control it well, it can lead to serious health problems, which include heart disease, vision loss, and or kidney disease. These are just to name a few. But with proper diet, working out, taking your medications as prescribed, and or seeking diabetes self-management education and support, it will ensure that you reduce the impact of diabetes on your life and reduce your chances of having one or more of these complications. Now, we'll start with complication 1, heart disease. Now, heart disease is one of the leading causes of death among individuals with diabetes. You're twice as likely to have heart disease or a stroke than anyone who does not have diabetes. Over time, a high blood sugar from diabetes can damage blood vessels. Blood vessels, as well as the nerves, are essential to getting blood to and away from the heart. which actually help to function everyday living and also helps your organs to function daily. You are most likely to have the other conditions. You're also more likely to have other conditions that raise your risk for heart disease, including high blood pressure, which puts an extra force on your arteries or can also damage your artery walls. So it's important in collaboration with managing your diabetes that you also manage your blood pressure because we've just learned that high blood sugars can damage your blood vessels as well as high blood pressure, therefore making it twice as the chances of you having any difficulty with blood flow throughout your body, because both of those will actually have damage to the arteries and or artery walls. So it's important to watch your diet to prevent you from having too much LDL cholesterol or bad cholesterol in your bloodstream, as well as high triglycerides, another bad fat. It's important to eat a lot of lean meats, fruits, vegetables, those types of things that will actually reduce the risk of you having those bad cholesterols within your bloodstream. If you work on keeping your blood sugar under control as well as your cholesterol, then there should really be no issues with down the road you having the condition of heart disease complications. To elaborate, lifestyle changes are a must. As stated, it's important to watch those things that you are eating. More fruits and vegetables, lean proteins, as well as whole grains are essential to help keep your blood sugar as well as your cholesterol levels under control. If you're overweight, work to lose weight, meaning put in that extra activity, meaning to at least try and get in 30 minutes, 5 times a week of physical activity. This will work to bring the weight off. That modest weight loss of at least 5 to 7% or 10 to 14 pounds will actually work to reduce the amount of triglycerides and bad cholesterol or LDL in your system, therefore reducing your risk of having a future heart attack or a stroke. I call them the ABCs. These are easy ways to remember the things that you should do to help keep your chances of having heart disease down. Get a regular A1C test. I'm sure you've heard this over and over again as you've gone to your doctor. So on average, it's required or suggested that you get it every 3 months, so you know where your blood sugar stands on an average. Of course, we'd suggest that you check it at home, but an A1C gives you that more accurate description of where your blood sugar stands. B, keep your blood sugar below 140/90 or the target that your doctor sets. It's important to remember that, of course, blood sugar can work to damage, high blood sugar can work to damage those blood vessels, but also high blood pressure can as well. So you want to work in keeping your blood pressure as well as your blood sugar under control. Next, control your cholesterol levels. Your doctor may have prescribed some medicine to assist with that, or has suggested for you to stay on a low fat, of course, lean meat, high fruit and vegetable diet. So stick to that. And then lastly, stop smoking or don't start. It's important, of course, to remember that smoking, along with high blood sugars and high blood pressure, also damages blood vessels and can make it more difficult for you to actually have blood pumping throughout your body. So it's important that if you are smoking, work with your doctor on a smoking cessation program. Use the National Tobacco Quit line, or don't start. If you're feeling a little stressed, talk to your doctor maybe about having some counseling or something of that sort, but don't start smoking. The ABCs of preventing heart disease. All right, question time. And I'm going to give you all a few seconds to think about this based on the actual things we just discussed with heart disease complications or heart complications. What can you do to prevent heart complications? A, eat a healthy diet. B, Exercise at least 150 minutes per week. C, limit alcohol use. Or D, all of the above. And I'm going to give you a few seconds to think about that. Choose your answer wisely. Okay, have you guys had time to think about that? All right, and we're going to show you the answer. All right, we see that a number of individuals did get it right, and the answer is D. It's important to remember that you want to eat a healthy diet, exercise at least 150 minutes per week, and of course, limit alcohol use. Alcohol, of course, does contain extra sugars. At this moment, it's our goal, of course, to make sure that we're limiting the amount of sugars in your body. So, of course, we want to limit alcohol use as well. So, D, all of the above. All right. Next complication, kidney disease. As stated, of course, we are aware, as we mentioned before, that high blood sugar does damage cells and blood vessels in our body, not only in our heart, but also in our kidneys. So it's important, once again, to make sure that you're following your doctor's plan of care when it comes to diet, exercise, and of course, taking your medications, because in your kidneys, it's the main goal of that particular organ to filter out waste as necessary. With the damage that might have been or that might be done to your kidneys due to high blood sugar, you're damaging the cells, and therefore it actually decreases the amount or the ability of your kidneys to function well, the ability of it to filter out the waste that is required. Over time, this could lead to chronic kidney disease. It usually gets worse over time if the blood sugar is not well controlled and could lead to kidney failure. If your kidneys fail, that might lead you to have regular dialysis, a treatment that filters out the waste in your blood, or a kidney transplant. So it's important to stay in the target blood sugar range target that your doctor suggests, as well as keeping your blood sugar under control, blood pressure under control. It's important to note, once again, just as we did with heart disease, that the two work hand in hand. It's important to work together with your physician and the things that he suggests to keep your blood sugar as well as your blood pressure under control to prevent those things from happening, including damaged blood cells as well as blood vessels. So, of course, you can have proper blood flow throughout the body, and then your kidneys can continue to work well to filter the waste from your body as necessary. Make sure to take the medicine as prescribed by your doctor. It's important. Sometimes, of course, we might feel like the medicine is causing issues, side effects. And so we're just going to try and stick with diet and exercise, but make sure to follow those three: diet, exercise, and medications. And speak with your doctor if you feel that you're having a side effect that you really don't like. Because, of course, the goal is to make sure that we're keeping the blood sugar and blood pressure under control. And we don't want any other issues to develop or complications because of the medicines that you're taking or not taking, for that matter. All right. Question 2. Blood pressure is not an important factor when it comes to preventing chronic kidney disease. A, true, or B, false? I'm going to give you a few seconds to think about that. I know you all are listening and paying attention, so I'm not worried. I know you're going to get this one right. Okay, and here we go. All right, I see a good number of you all got that one. Now, it is important to note that once again, that blood sugar and blood pressure are going hand in hand when it comes to your kidneys. So high blood sugar and high blood pressure can also affect the amount of, it can also affect how things are going in your body. So once again, just like with heart disease, high blood pressure, and high blood sugar affects the vessels and the cells in your heart, and it also can affect the cells and vessels in your kidneys and actually prevent them from working as well as they should. So do note, it's important to keep your blood sugar within the normal range as well as your blood pressure. Next, nerve damage. Now, I'm sure that you've heard the doctor say that, of course, you might have developed neuropathy or that it is a possibility of developing neuropathy. Once again, it's important to keep that blood sugar under control because neuropathy can affect the nerves in your arms and your legs. Sometimes it can just feel like mild numbness to pain or pain that makes it hard to do normal activities. Sometimes it can affect other parts of your body, including your stomach, your heart, or maybe even other organs in your body. Many people have nerve problems, but not all have symptoms. The longer you have the diabetes, the more likely you'll have nerve damage. So it's important that over time, after you've been diagnosed with diabetes, that you work continuously to try and keep those blood sugar levels under control. Meaning stay as active as possible. Once again, trying to stay as focused as you can on diet and taking the medication as you should. Once again, nerve damage can be affected by blood pressure. So it's important to make sure that you're keeping that low as well, under 140/90 or the target that your doctor sets. So it's important to stay as focused as you can with also losing weight if you're overweight, limiting or avoiding alcohol, and once again, not smoking or don't start. Once again, smoking affects vessels and cells in your bodies that are working to do the things that your body needs. Your nerves are very important. Your nerves are actually there to make sure that you're feeling pain, that you're making sure that if you do get a bruise, if you do get a cut, that it works to help you keep you from getting an infection down the road. So you want to make sure that you're doing what's necessary to stay in the targets of your blood sugar, your blood pressure, and of course your weight to make sure that things are kept within that normal range to prevent future damage to your nerves or causing any future issues down the road. All right, next question. To prevent nerve damage, which one is not true? A, keep your blood sugar under 140/90. B, smoke twice a day. C, lose weight if overweight. And lastly, D, get regular physical activity. Keyword, which one is not? I know you got this. All right. And our answer is, let's see how well you all did. All right, very good. All right. Now it's important to note, once again, to not smoke or don't start. So stop smoking or don't start. It's important to remember that because smoking, just as high blood sugars and high blood pressure, affect the way that things flow in your body. And of course, they can cause nerve damage. So it's important to make sure that you don't smoke. So not to smoke twice a day, don't smoke at all, or at least work on quitting. All right, next, foot health. Now, it's important, of course, as we just mentioned, to note that nerve damage can lower your ability to feel pain, heat, or cold. If you don't feel that pain, heat, and or cold, you may not notice that there's a cut, sore, or even that the water in the bathtub or the shower is too hot. These small problems can be serious if they aren't treated earlier. Poor circulation, along with nerve damage, puts you at risk for developing a foot ulcer. That's a sore or a wound that's open that could get infected and not heal well. Eventually, that infection, because you didn't feel it due to the nerve damage, could turn into something a little more serious, causing an amputation to prevent the infection from spreading. I know none of you all want to go through that, but it's important to remember that the chances of having that can be reduced by checking your feet daily for any cuts, bruises, sores, washing your feet in only warm water, not hot, trimming your toenails, and of course, filing them to make sure that, of course, even though you trimmed them, that there's no sharp edges to cause any other injuries. Maybe when you're laying down or your feet rest up against another part of your body, you just don't want to cause any chances of there being any cuts, bruises, or sores due to hard or sharp toenails. You also want to make sure that you wear shoes that fit well. Make sure to break in those shoes, any new shoes, when you get them, at least 1 to 2 hours each day until they feel comfortable. You don't want tight shoes because what will happen, the tight shoes could eventually lead to blisters and sores. And if you have just a slight amount of nerve damage on your feet, you've been working hard to try and keep your blood sugar under control, but you just might not feel it in your feet. So it's important to make sure that you wear shoes that fit well, but not too tight. Never go barefoot, of course, because you could step on something that could cause you to have a cut and or sore or a bruise. And always put your feet up when you're sitting. Wiggle your toes for a minute. Make sure that, of course, you're having that feeling. Make sure that there's no nerve damage. And if you feel anything different, if you touch your foot, if you're rubbing your feet and you feel that you're not feeling them like you used to, the feeling is not there, or there's tingling, something different than the last time you had your feet checked, make sure that you mention it to your doctor. Don't wait for your yearly exam. You want to make sure that you let your healthcare provider know at the earliest point so that problem can be solved. Maybe there's an issue with your blood sugar. Maybe a medication needs to be changed. Maybe you need to see a foot specialist, but definitely mention that to your doctor early on. All right, next question. Washing feet in hot water and wearing tight shoes are essential to prevent foot complications. A, true, B, false. You got this. All right. Now let's see what you guys got. Good job. Good job. Now it's important to remember, as stated, to make sure that you wash your feet only in warm water, and of course, wear shoes that fit well, but not too tight. You might have nerve damage there, and you might not be able to feel that hot water. So it's important to note to wash your feet only in warm water. It's important to note that wearing tight shoes could cause bruises, sores, and or cuts. So make sure that you're only wearing shoes that fit well, and make sure to break them in at least 1 to 2 hours or until you feel comfortable. New shoes. All right. Now, oral health, or the health of your mouth. High blood sugar increases the level of sugars. We've already established that. The level of sugar in your bloodstream. But it also increases that level of sugar in your saliva. Sugar feeds the bacteria in your mouth, and when that bacteria is combined with food, it over time creates plaque. That plaque can eventually cause tooth decay. People with diabetes are generally more likely to have gum disease due to this ability of plaque to build up in their mouths. That leads to tooth loss. Gum disease also can make blood sugar levels rise and make diabetes harder to manage. Treating gum disease can lower blood sugar over time and reduce the chance of other diabetes problems such as heart disease and kidney failure. So it's important to make sure that you're not only taking care of your heart, of course, your feet, of course, your nerves, but also your oral health. So making sure to brush twice a day, floss once a day. If you have dentures, make sure to remove and clean them daily. Let your doctor know if you're having any issues with your gums, the way that the dentures are fitting, because of course that bruising, because you could have some issues with nerve damage. You might not feel what's going on there. Make sure that you mention to your doctor if things just aren't feeling the same way they used to when you put your dentures in, maybe the last time you were at the dentist. Of course, as always, keeping your blood sugar within that target range will ensure that the high blood sugar doesn't have that chance of actually interacting or over interacting with the bacteria in your mouth and causing any tooth loss or tooth decay. Regular dental checkups are essential, and always let your dentist know that you're diabetic. Once again, stop smoking or don't start. Smoking also affects your mouth. It can increase the chances of you having a sore in your mouth that might not heal, therefore causing an infection. Therefore, as stated before, getting into your bloodstream and possibly affecting your heart and or your kidney. Make sure you call your dentist right away if your gums are starting to swell and or they're bleeding, because that could be a sign of a tooth infection. And therefore, it could lead to other infections within your bloodstream. So make sure that you mention that to your doctor. But it's important to keep your mouth clean as much as possible, at least brushing twice a day and flossing once a day. And your dentist will give you certain suggestions and tips in reference to making sure that you keep not only a healthy mouth, but of course, making sure to prevent any bruises, any soreness, that type of thing as well. But your healthcare provider, your diabetes educator, your diabetes specialist, your primary care doctor will be working with you, of course, to keep your blood sugar under control. All right, next, hearing loss. Now it's important to note that, of course, as we've stated before, that blood sugar affects blood vessels if it's not well controlled. It's no different in the way you hear. Hearing loss is twice as common in people who have diabetes than in those who don't. Over time, high blood sugar levels can damage small blood vessels and nerves. You know, we talked about that before, about high blood sugar affecting blood vessels and nerves in our body. They also affect the blood vessels and nerves in our inner ear. That can affect, of course, the way you're hearing. It can actually show a sign of you having hearing loss by having problems of hearing someone in a busy restaurant, thinking that people are mumbling, asking people to repeat themselves, or needing to turn the TV up because you think you can't hear it. It's important to keep your blood sugar, once again, within the target range, because, of course, that could affect not only, once again, your oral health, your foot health, and or your heart health, but also your hearing. Get your hearing checked yearly as well. So just as you're getting your feet checked, your mouth checked, Make sure to get your hearing checked yearly. Avoid causes of hearing loss, including smoking, as we talked about. Smoking damages nerves, and it can also damage those nerves in your ear. So it's important that you keep those chemicals out of your body, keep your blood sugar under control, and of course, watch the loud noises that you could be around to avoid any other cause of hearing loss. And ask your doctor if there's any medicines that you can take, that you're taking, I should say, that might cause damage to your hearing, and what other options are available. So hopefully, of course, you won't go through that. But if you do, I'm sure that there could be other options available to assist with the hearing loss, including hearing aids, or other types of things that maybe an audiologist or a hearing loss specialist might recommend. All right, and next, of course, you could encounter vision loss. I'm sure you probably heard this term over the time you might have been diagnosed as a diabetic, or maybe not, but it is a very common diabetes complication. Diabetic retinopathy, the leading cause of blindness in American adults. Now, over time, as stated once again, that's why it's very important to work to keep your blood sugar and blood pressure under control. High blood sugar levels and high blood pressure levels can damage small blood vessels in your retina. That's the light sensitive layer at the back of your eye. Now, new blood vessels could develop, but over time, you won't get the same type of vision that you might have had before. And usually both eyes are affected. So I generally stress to my patients or members that it's important, of course, to make sure that you're following the diet as suggested by your doctor, that you're trying to get in that physical activity. And right now, it could be a lot more difficult with COVID and with the weather change, but maybe getting in some brisk walking around the house. I always suggest those things to work to keep blood sugar under control, because ultimately it affects one of the main organs in your body that, of course, you would like to keep, and that's your sight. People with diabetes are even more likely to develop cataracts, which is a clouding of the lens, which makes it more difficult to see, and or glaucoma, a group of diseases that affect the optic nerve. So affect your ability to see clearly as far as you might have used to, actually causing you to have have the ability or not have the ability to see, but also getting a stronger prescription if it comes to glasses. And so it's important to work as hard as you can, of course, with diabetes care, including diet, exercise, and of course the medication that you're taking, because as you see thus far, it could affect a number of the different systems in your body. So once again, as stated, keeping blood sugar, blood pressure, and cholesterol levels within the target, exercise regularly, not smoking, eating more fruits and vegetables, and taking the medication as prescribed. And always, always get your eyes dilated once a year. If you go to your doctor and you're seeing the doctor regularly, of course, staying on track with the other things that we mentioned, that's great. But it's important for your eye doctor to know where your eyes stand. And if you're getting them dilated, you can ensure that the doctor's catching any issues that could be going on with them early. So make sure that you aim to keep that appointment yearly of getting your eyes dilated. All right, then lastly, of course, diabetes can be stressful, and definitely during this time with COVID, because a lot of you all might not have been able to see your doctors as you would have liked. A lot of you all might not have been able to be as active as you would have liked because you're trying to protect yourself. I understand that. You're within a highly susceptible population. So it's important to remember that even during these times, that you seek the help that is needed to help keep you stress-free, because ultimately it can affect your mental health. People with diabetes find it hard to handle this particular disease state, but many don't get the help they need. Depression is more common among those individuals with diabetes, but only generally 25 to 50% get diagnosed and treated. It's important that if you're feeling different emotionally, if you're feeling an extra stress on your shoulder, if there's something that's causing you to feel frustrated, discouraged, and or maybe tired of dealing with diabetes, that you first reach out to your primary care doctor. I know as stated, it could be difficult right now to get into the office for your primary care, but you can reach out to them hopefully on the phone. Let them know what you're going through. Maybe they can help you along the path with maybe a suggested health coach like me, or a nurse, of course, as we have with the Mera Group, a diabetes support group, because I know a number of them are still doing virtual calls. It's important, of course, that you seek the help that might be needed, because it will help you stay focused and on track. As we mentioned, there are a number of other health complications that could occur from not keeping your blood sugar under control. And the last thing we want is for you to slip into some unhealthy habits, which means eating unhealthy food or skipping your physical activity. It's important to note that besides your primary care physician, that there are mental health counselors, there's diabetes support groups, there's groups like the Diabetes Association of Atlanta that can actually suggest and make recommendations for you. And of course, a Mera group that can make recommendations for you to have assistance to keep on track of keeping your diabetes under control. The last thing we want, of course, is for you to make that transition into having some difficulties and otherwise some complications. All right, and lastly, because you've heard me stress these points over and over again during this presentation, one last question. The three most important ways to prevent diabetes complications include eating a healthy diet, getting at least 150 minutes of physical activity per week, keeping blood pressure under 140/90, smoking, or E, A, B, and C. Gonna give you a few minutes to think about that. A few seconds, I should say, to think about that. I know you got this. I know you're already doing it, so I know you got this. All right, let's see what you all chose. All right, good job, you guys. Of course, everything on that PowerPoint slide except D. You want to make sure that you do not smoke at all, of course. And if you're smoking, you want to work to stop. So speaking to your doctor in reference to smoking cessation, one of our general health coaches here and or nurses and or using the National Tobacco Quit line is essential, because we've learned today that, of course, smoking, the chemicals associated with it, can affect your blood vessels and the nerves in your body, and of course cause complications. So it's important to stay as focused as you can on diet, lean meats, fruits, vegetables, high fiber grains, of course exercise, at least getting 30 minutes in 5 times a week of at least brisk walking. And lastly, of course, staying as focused as you can on taking your medication as prescribed. It's important, of course, to note that you do have at all times, of course, assistance, resources to stay on track with those types of things. So if at any time, of course, you feel that you might need further assistance outside of your doctor, it's important to make sure that you check out some of the other resources that I mentioned here. So, for more information, of course, as stated, on how to not only keep your diabetes under control, but to prevent diabetes complications, always speak to your primary care physician or diabetes specialist. If you might have an endocrinologist or another type of specialist, diabetes educator in your life, speak to them. They're there for that. They're there to provide you that assistance. Also, making sure to check out the CDC's website, cdc.gov/diabetes, actually, the American Diabetes Association, diabetes.org, or the Diabetes Association of Atlanta, diabetesatlanta.org. And as a proud health coach of AmeriGroup, I actually will encourage you to give us a call if you are an AmeriGroup member to speak with one of the health coaches and or nurses. You can press the 678-587-4868 number and press option 2 for the health coach. I'll work to assist you. And if we feel that you need further assistance, we can direct you to one of our nurses that can follow you a little longer. It's important, as I see that the link popped up for the Tobacco Quit line, if there is anyone who could be having difficulty with quitting smoking, that you reach out to the Tobacco Quit line. There is a link there to click, and you can always give them a call, 1-800-QUIT-NOW. They work to provide assistance, tips, information to help you along that smoking cessation path. It's important, of course, that you incorporate that along with diet, exercise, and medications to make sure that you're doing what's necessary to keep your blood sugar, blood pressure, weight under control, to make sure that we work to prevent any diabetes complications. I appreciate your time. Now, are there any questions?
Thanks so much, Quentin. That was a lot of great information, and there are, some really, some really good things that you can do to help, prevent diabetes. So thank you, or
You,
diabetes complications today, and thank you so much for sharing that. We don't have any questions right now, but anyone in the audience, feel free to type in your question into the chat box. And while you're doing that, I'll ask Quentin a question.